Hi guys. I think it's been a while since I've done an update. If it hasn't been that long, a lot has occurred in the last week or so. I probably should have gone back and watched my last update because I don't remember where I stood, but I think basically I was in the process of I had ordered my syringes and needles, and I was getting ready to order all of my meds. I found a location to order them from that had the best pricing. I queued up my order, and I ran into a few roadblocks in trying to purchase the meds. Just minor technicalities, but enough that it held me up long enough that I got some news back prior to making the purchase regarding some of my tests that I had done, my antibody tests. If you recall, I was waiting for a few last tests to come back, and that's where everything took a big turn. The few tests that I was waiting more for were 3 antibody tests. Well, my doctor called and I had gotten the results of 2 antibody tests, but one of them was wrong. It wasn't even one that my doctor requested. So I was looking, the name of the 3 tests are ATA, APA, and AMA, and I think I passed one of them. I think it was the ATA. That one came back negative. But for the AMA test, that's, I forgot what it stands for. It's a really long word that I couldn't pronounce if I wanted to. But basically, instead of testing my AMA, I got back my AMA M2. And that is a variation of the AMA test. There's a range. There's an M1 through M9 on the AMA test. M2 was one of them. M2 stands for mitochondrial antibody. That came back positive. I came back above the high end of the range. And basically it said right on the blood labs, and I've done some research since then that said that the mitochondrial antibody test, 90 to 96% of people who test positive for this have primary biliary cirrhosis. So basically cirrhosis of the liver. And not the type of cirrhosis that most of us are accustomed to from drinking or drugs or doing things to abuse your liver. This particular type of cirrhosis is called, again, PBC, primary biliary cirrhosis, if I'm saying it right. And this one, they believe, is a form of autoimmune disease. So, because it wasn't a test that my doctor said that she requested, because remember, I had to have my general practitioner, my U.S. doctor, request the tests on behalf of my Barbados doctor, because the labs here in the U.S. will not take a lab rec from out of the country. So basically, my primary physician rewrote the lab rec for me and then ordered the test. So that added a level to the confusion. The tests say that they got a verbal confirmation from my clinic in Barbados that says that they ordered the M2 test, which I don't know. I think what happened is we ordered the AMA, my doctor ordered the AMA, it went to LabCorp. LabCorp, maybe the tests vary, I don't know. LabCorp probably called my doctor's office back, asked for clarification, and because my doctor's office was ordering it on behalf of Dr. Skinner, they referred LabCorp to Dr. Skinner, and therefore there was the note in the lab works that says verbal from blah, blah, blah. So, I don't know. My doctor's office in Barbados says nobody called them, but who knows what exactly happened. So because this was such a cluster and I didn't really know why that test was taken, to be on the safe side, I had to go back to get more blood redrawn anyway because I had a test missing. So I asked them to retest me on that particular test. just to make sure it was mine before I went into panic mode, because that's a pretty serious positive test result. So on Tuesday of last week, I believe it was, I went and had my blood redrawn. And on Wednesday or Thursday, I got the results that it had tested positive again, and it was elevated even higher than the first time. So at that point, I asked my GP what are the next steps, and she said that she's going to refer me to a specialist, a GI, and she was going to order an ultrasound because that specialist was going to want an ultrasound anyway of my internal organs. So on Saturday of this past week, I went in for an ultrasound, and they basically did it of my liver and spleen and gallbladder and kidneys. Those test results should be coming in today or being read by a radiologist today and then sent over to my GP to let me know what I need to do, A, and B, send me to see a GI specialist. She's going to send those to the specialist. So, what does all this mean? Well, one, I haven't ordered my meds because the medications are pretty expensive, over $3,000, and if I get them and I can't use them, I can't return them. And selling them on the black market's illegal. Well, I could certainly, try to get rid of them. It's just too much stress, and it's not necessarily legal, so I don't want to deal with that. So that puts me in a little bit of a precarious situation, because the meds coming from the UK can take upwards of 2 weeks to get here, and I need to start my medication in about 3.5 weeks. So that turns all of this into a pretty urgent situation as far as getting answers, because if I do have liver disease, and especially if I have cirrhosis, I don't think that it would be wise to go in and inject myself full of medications that my body would struggle to process. I can't put any stress on my liver. And my liver would have to process all of that, basically. So that would be basically a showstopper and a deal breaker. And not just, yes, because of my health, that's my primary concern. But also because, there's risks involved with getting pregnant when you have cirrhosis of the liver. And then I'm also, the last couple days while I've had time to absorb this information and take it in, I also have some serious concerns about genetics and passing on this autoimmune disease to any of our children, should we have any. What I got, autoimmune disease is pretty much genetic, not necessarily cirrhosis of the liver per se, but autoimmune in general. And the cirrhosis is a form of autoimmune disease. So as you guys know, I am hypothyroid, and I'm Hashimoto's hypothyroid, which means that it's a form of autoimmune disease. My immune system is attacking healthy tissue, which is my thyroid. I also have endometriosis, which is, again, my immune system attacking healthy tissue, which is my reproductive system. So there's 2 strikes. I also have psoriasis, and that is my immune system, again, going to work. And so the reason that I've been fairly upset and concerned is because I wouldn't be surprised if it is attacking my liver, as much as I don't want that to be true, and I don't want to have to deal with a degenerative disease like that. The thyroid is one thing. You take a pill and you manage it the rest of your life. It's not necessarily going to kill you. The endometriosis is another thing. You manage it. You might have surgery to remove it, or you manage the pain, but it's not necessarily going to kill you. The liver disease is a little bit different because it's degenerative. There's no cure for it, and it will eventually, or can eventually, kill you. I've read that from the time of diagnosis, a person usually has 10 years before that becomes critical, in the sense that you probably will need a liver transplant. So that only puts me at the age of 50. And that's very young, you know, to be having those types of issues. And, you know, do I want to have a 9-year-old and have to go get a liver transplant? Or do I want to take the risk of passing this on to our children? I don't know. I'm still waiting for some answers before I can really make a final decision. And Frank and I will talk about this, of course, and make a final decision. But number one is my health, and, you know, make sure I'm not endangering my health. And number two is making sure that I don't endanger or risk the health of our child, potential child. And then, you know, there's just a lot to consider here. So this has all been a very big shock to me. It's a surprise. I wasn't expecting that. The worst case scenario I was looking at was needing to do something called intralipids if some of my tests came back positive for antibodies, because the intralipids would help prevent my body from attacking the embryo. So this is a whole new level to the game. It's nothing that none of us expected. You know, I don't necessarily believe in mistakes, and I believe that this was a hidden blessing, and that is disturbing and frightening as it is. You know, the fact that I couldn't purchase my meds and I had all those roadblocks, and then this came up, you know, the day that I finally got my situations cleared up. I had several situations occurring. The day I finally got that all cleared up to purchase my meds is the day that I got the test results back. And I didn't have time in between to purchase the meds. I mean, I literally got it cleared on the way home from work Friday, and on the way home from work Friday, I got the test results back. So, you know, I don't believe in coincidence or mistakes. I think that this all happened for a reason, and so I'm grateful for that. The timing of this was kind of crappy. You know, it was when my best friend was here to visit. Hi, Marge. So, you know, I had to drag her with me to go get these tests, and I had all of this weighing heavy on my mind while she was here. But it was great to have her here too, because it helped serve as a distraction, but she's also a great support system for me. So, you know, everything works out in the end. So this video is really super long. I'm really sorry, but there was a lot to update you on. And what I'm going to do is update you again as soon as I get answers or know what the next step is. So, you know, IVF might be off, but I think that if it is, that we will at least still take a 1 week's vacation to Barbados, so we don't lose what we put down in terms of our accommodations and our airfare and all that. We might have to pay some change fees, but I think that if we can't do IVF, that taking a vacation is probably something that we need to do at this point. So that's all I got today for you guys, and again, I will update you as soon as I can. Talk to you soon. Bye.